Your kidneys are two of the most hard-working organs in your entire body. Every single day they filter about 50 gallons of blood, removing waste, balancing fluids, and keeping your system running smoothly. But here's the problem. Kidney disease is often called a silent killer because it can progress for years without obvious symptoms. By the time most people realize something is wrong, significant damage may have already occurred. And after the age of 50, the risk increases dramatically. Many people ignore the early warning signs because they seem normal. A little swelling in the feet, must be standing too long, feeling tired all the time. That's just aging, trouble sleeping, stress. But sometimes these small changes are your body's way of telling you that your kidneys are struggling. And the earlier you catch it, the better your chances of slowing down or even preventing serious kidney damage. In this video, I'm going to walk you through 10 warning signs that your kidneys may be in trouble. Some of these are well known, but others are so subtle that most people dismiss them completely. And here's something important. The last sign on this list is one of the most overlooked, yet it can be one of the earliest indicators that something is going wrong. So make sure you watch all the way to the end, because understanding these signs could help you catch kidney disease before it's too late. Before we begin, I want to make something clear. Many of these symptoms can be caused by other health conditions, and this video is not meant to diagnose or replace the advice of a healthcare professional. If you're experiencing any of these signs, especially if they're persistent or getting worse, it's important to talk to your doctor and get the proper tests done. Now tell me in the comments where you're watching from and which symptom worries you the most. Let's get started. Number 1. Persistent fatigue and weakness. Feeling tired from time to time is normal, especially as we get older. But if you find yourself constantly exhausted, even after a full night's sleep, it may be more than just aging or stress. Your kidneys produce a hormone called erythropoietin, which signals your bone marrow to make red blood cells. When your kidneys aren't working properly, they produce less of this hormone, which can lead to anemia. Anemia means your body doesn't have enough healthy red blood cells to carry oxygen to your tissues, and that's what makes you feel weak, drained, and unable to get through the day. Many people blame it on their busy schedule, poor sleep, or just getting older, but when the fatigue doesn't go away no matter how much you rest, it's worth paying attention. If left unchecked, chronic fatigue can affect your ability to work, exercise, and enjoy daily life. Early evaluation can help identify whether your kidneys are the root cause, and treating the underlying issue can restore your energy levels and improve your quality of life. Number 2. Swelling in the hands, feet, ankles, or face. Swelling, also known as edema, happens when your body retains too much fluid. Your kidneys are responsible for removing excess water and sodium from your blood. When they start to fail, fluid builds up in your tissues, particularly in your lower body due to gravity. You might notice that your shoes feel tight by the end of the day, your rings don't fit anymore, or your ankles look puffy. Some people also experience swelling around the eyes, especially in the morning. This may seem harmless at first, and many people think it's just from eating salty food or standing too long. But when the swelling is persistent, doesn't go away with rest, or gets worse over time, it may be a sign that your kidneys are struggling to balance fluids. Ignoring this symptom can lead to more serious fluid overload, which can affect your heart and lungs. Catching it early allows your doctor to run tests, adjust your diet, and possibly start treatments that can prevent further kidney damage and reduce the swelling. Number 3. Changes in urination. Your kidneys are directly responsible for making urine, so any change in how often you go, how much you produce, or what your urine looks like should never be ignored. Some people with kidney problems find themselves urinating much more frequently, especially at night. This condition, called nocturia, can disrupt your sleep and leave you feeling exhausted. On the other hand, some people urinate less than usual, which means the kidneys aren't filtering waste effectively. You might also notice that your urine looks foamy or bubbly, which can be a sign of protein in the urine, a condition called proteinuria. Healthy kidneys keep protein in the blood, but damaged kidneys let it leak into the urine. Another warning sign is blood in the urine, which may make it look pink, red, or cola-colored. Many people dismiss these changes, thinking they're just drinking too much water or not enough, or that it's a temporary infection. But when these changes persist, they need to be checked. Early detection of proteinuria or hematuria can lead to interventions that protect your kidney function and prevent progression to kidney failure. Number 4. High blood pressure that's hard to control. High blood pressure and kidney disease have a complicated relationship. Your kidneys help regulate blood pressure by controlling fluid levels and releasing hormones. When your kidneys are damaged, they can cause your blood pressure to rise. But high blood pressure can also damage your kidneys, creating a vicious cycle. If you've been diagnosed with high blood pressure and it's difficult to control even with medication, it may be a sign that your kidneys are involved. Some people don't realize they have high blood pressure at all because it often has no symptoms, which is why it's called the silent killer. But when it's linked to kidney disease, it becomes even more dangerous. Uncontrolled high blood pressure can lead to heart attack, stroke, and further kidney damage. The good news is that managing your blood pressure with lifestyle changes and medication can slow the progression of kidney disease. Regular monitoring and working closely with your healthcare provider can help protect both your heart and your kidneys. Number 5. Shortness of breath. Shortness of breath can happen for many reasons, but when it's related to kidney disease, it's often due to one of two things: fluid buildup in the lungs or anemia. When your kidneys can't remove excess fluid, it can accumulate in your lungs, making it hard to breathe, especially when you lie down. This is a serious condition that requires immediate medical attention. Anemia, as I mentioned earlier, reduces the oxygen-carrying capacity of your blood, which can also leave you feeling breathless, even during light activities like walking or climbing stairs. Many people assume it's just being out of shape, gaining weight, or getting older. But when shortness of breath is new, worsening, or happens even at rest, it's a red flag. If left untreated, fluid overload can lead to heart failure, and severe anemia can damage your organs. Early diagnosis and treatment, including managing fluid intake, adjusting medications, and treating anemia, can make a huge difference in your breathing and overall health. Number 6. Nausea, vomiting, and loss of appetite. When your kidneys aren't filtering waste properly, toxins build up in your blood, a condition called uremia. This buildup can cause nausea, vomiting, and a complete loss of appetite. You might feel sick to your stomach, especially in the morning, or find that food just doesn't taste good anymore. Some people also experience a metallic taste in their mouth. These symptoms can lead to unintentional weight loss and malnutrition, which weakens your body even further. Many people think it's just a stomach bug, food poisoning, or stress. But when nausea and loss of appetite persist for weeks without an obvious cause, it may be linked to kidney dysfunction. Ignoring these symptoms can lead to severe malnutrition, dangerous weight loss, and worsening kidney function. Getting evaluated early can help identify the cause, and treatments such as dietary changes, medications to reduce nausea, and managing toxin levels can improve your symptoms and protect your kidneys. Number 7. Difficulty concentrating and brain fog. When toxins build up in your bloodstream due to poor kidney function, they can affect your brain. You might find it hard to focus, have trouble remembering things, or feel mentally foggy throughout the day. This can make it difficult to work, drive, or even have a conversation. Some people also experience dizziness or confusion. Anemia, which often accompanies kidney disease, also reduces oxygen to the brain, making these cognitive symptoms worse. Many people blame it on aging, lack of sleep, or stress, and they don't realize it could be related to their kidneys. But when brain fog is persistent and accompanied by other symptoms on this list, it's worth investigating. If left untreated, severe uremia can lead to more serious neurological problems, including seizures. Early intervention can help clear toxins from your blood, improve mental clarity, and restore your ability to think clearly and function normally. Number 8. Skin rashes and severe itching. Itchy skin is one of the most frustrating symptoms of kidney disease, and it can happen even before other symptoms appear. When your kidneys can't filter waste properly, toxins and minerals like phosphorus build up in your blood and settle under your skin, causing intense itching. This itching can be so severe that it disrupts sleep and daily life. You might also notice dry, flaky skin or a rash. Some people scratch so much that they develop sores or infections. Many people think it's just dry skin, allergies, or a reaction to soap or laundry detergent. But when moisturizers and antihistamines don't help, and the itching is all over your body, especially worse at night, it may be a sign of kidney problems. Ignoring this symptom can lead to skin damage, infections, and a lower quality of life. Early detection allows your doctor to adjust your diet, medications, or dialysis schedule to reduce toxin buildup and relieve the itching. Number 9. Muscle cramps and restless legs. Muscle cramps, especially in the legs, are common in people with kidney disease. When your kidneys aren't working properly, electrolyte imbalances occur. Low levels of calcium, high levels of phosphorus, or imbalances in potassium and magnesium can all cause painful muscle cramps and spasms. Some people also experience restless leg syndrome, where they feel an uncontrollable urge to move their legs, especially at night. This can make it nearly impossible to sleep. Many people assume cramps are just from dehydration, overexertion, or lack of stretching. But when they happen frequently, especially at night, and are accompanied by other symptoms, they may be a sign of kidney dysfunction. If left untreated, severe electrolyte imbalances can lead to dangerous heart rhythms and even cardiac arrest. Early diagnosis and management, including dietary changes and medications to balance electrolytes, can reduce cramps, improve sleep, and protect your heart. Number 10. Changes in taste and bad breath. This is one of the most overlooked signs, but it can be one of the earliest indicators of kidney trouble. When waste products build up in your blood, they can cause a condition called uremic fever, which gives your breath an ammonia-like smell. You might also notice a metallic or bitter taste in your mouth that doesn't go away, even after brushing your teeth. This can make food taste unpleasant and contribute to loss of appetite. Some people also develop mouth sores or a coated tongue. Many people think it's just poor dental hygiene, something they ate, or a side effect of medication. But when these symptoms persist despite good oral care, they may be linked to kidney disease. Ignoring this can lead to worsening uremia, malnutrition, and further decline in kidney function. Early evaluation can help identify the cause, and managing toxin levels through diet, medication, or dialysis can restore your sense of taste and improve your breath. So there you have it. 10 warning signs that your kidneys may be in trouble. Your body speaks to you through signs and symptoms, and when something keeps happening, it's important to listen. Kidney disease is often silent in its early stages, but that doesn't mean it's not happening. The good news is that early detection can make all the difference. With the right care, lifestyle changes, and medical treatment, you can slow the progression of kidney disease, protect your overall health, and maintain your quality of life. If you're experiencing any of these symptoms, don't wait. Talk to your doctor and ask for kidney function tests, including blood tests to check your creatinine and GFR levels, and urine tests to check for protein or blood. You deserve answers, and you deserve peace of mind. If you found this video helpful, please share it with someone who might benefit. And remember, take care of yourself, listen to your body, and I'll see you in the next video.